And good morning. It's July 15, 2025, Tuesday. I'm Dr. Duke Mage, and our patient travels here from Virginia. Virginia, the beautiful state of Virginia. She's had an unfortunate history involving her neck. Can you guys see the x-ray, Henry? Shot?
Yes, we can.
She's got these two fusion cages that were put in Virginia. Very, very sloppy work. They're too short. Look at the spine, how crooked it is, right where the cages are. It's caused her to be kyphotic and scoliotic. So the technique was bad, putting the cages in. The cages are the wrong type of cages to put in. There's no plate. It's just the typical kind of garbage that spine surgeons are doing today. They're doing it because they're profiting hugely on putting these devices in that don't work. And then patients are in horrible pain afterwards. So she comes here to Duke Spine with facet joint pain, with occipital neuralgia on the left, which Dr. Patel just performed the Duke plasma rhizotomy for, and she also has a herniation at C2-C5, which is pressing her spinal cord. We're going to treat her herniation next. We're starting with facet treatment. She's getting the Duke plasma rhizotomy for painful facet joints above her fusion, and these are caused by the fusion. Shot? Henry, why don't we go ahead and show the audience how the Duke plasma rhizotomy fixes facet joint pain and how facets cause pain.
Of course.
Welcome back. You can see how facet joint pain is caused by arthritis within the facet joints. That arthritis is due to an injury of the facet joints. Shot. And facet joint injuries are very common. They happen with trauma to the neck, usually a car accident, for example, or a slip and fall. She's been in a wheelchair now for a few months, and when I asked her why, she said that she's just always in pain, always on narcotic painkillers for her pain, and she can't live a normal life. She's miserable. Her husband, unfortunately, is obviously he's sad. He cares about her very much. and he wants his wife to feel better. So that's why we're trying to help her by eliminating her facet pain. We're also going to treat her herniated disc if we can. One issue, she does have pretty bad anemia, but it's a chronic anemia. She's had it for years. Anemia of chronic disease most likely. All right, and so we have to, thank God we don't lose much blood during the surgery. Shot. She does have really bad deformity of the spine because of that old fusion she had done in Virginia. They just did not do a very good job with that fusion. And as a result, she now has adjacent segment disease. She's losing the curvature of her spine. She's twisting her spine, kyphosing her spine. She's just in really bad shape from an alignment standpoint. All right, we're starting the right side here with her facets. Shot. Any questions?
At this moment, no current questions.
All right. I've got to target those pain nerves we talked about earlier. Dr. B, everything okay, Sean? Huh? Once again, we've already done the occipital nerve. Huh? Good. Any questions about her facet pain and how we're treating it?
At this moment, no
Sean?
current questions.
Excellent. Shot. 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 When I say shot, by the way, I'm not talking about giving the patient a shot of medicine. I'm talking about taking a picture with our X-ray machine. Some doctors say shot, some doctors say picture, some doctors say X-ray. I was trained at a time when it was popular to say the word shot, and that's why I say shot, because you're taking a shot, a picture shot. All right, we're just about done here, and then we're going to flip her over, and we're going to do her disc at C3-4. Shot. That disc is herniated and pushing on her spinal cord. I think it's contributing to her myelopathic symptoms of balance difficulty. All right, we're done.
Sitting on, please. Thank you.
Any questions?
At this moment, no current questions.
All right, we did all this with 2 4mm incisions and virtually no bleeding, just probably about 4 milliliters of bleeding, 4 ml. Keep pressure on your side. I'll go ahead and deal with mine. And why don't we go ahead and end the stream with a testimonial, and then we'll see you guys back shortly for the surgery in the front of her neck. And good morning, I'm Dr. Duke Majan at the Duke Spine Institute. I'm here with my patient who traveled to Duke Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle motorcycle accident back in October and it flew off the bike.
And you've been suffering since then.
Yeah.
Why did you decide to come to Duke Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck and it was really bad. I would turn my head anyway and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research trying to look for exercises I could do to help my disc, he popped up on my feed and said, do you have a herniated disc? I can fix you. And the more research I did, I was just so thrilled because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it and I was like, you're done already? The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Duke laser disc repair and the Duke plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.